when unexpected infertility is difficult to diagnose? Are there clues? Because right now we mentioned, or maybe right in these days is not as unexplained as such because people are doing tests, people are more aware. But are there situations where it is so difficult to diagnose and there are certain things that medical personnel like as you look for that will help them? Because really it's about digging through to really find out what exactly is causing this thing.
What exactly is the
Yeah.
cause? Yeah.
Yeah, that's my question.
Okay, okay. So generally there are about 6 causes of unexplained infertility.
Okay.
Okay, you can imagine it's just like a paradox saying it is unexplained, but now you now have explanation for the unexplanation. You understand? Yes, that is just a joke. But really, there are 6 causes of unexplained infertility. Number one is genetic alterations in the egg of the woman. So you now and genetic alterations in the egg of the woman, genetic alterations in the sperm of the man,
Okay.
alterations in the embryo. Embryo is the cell that is formed from the fertilization of the egg of the woman by a sperm. Okay, genetic alteration that appears in the embryo. Number 4 is implantation failure. Number 5, mild tuber scarring. So mild tuber scarring means there are some small scar tissue formation inside of the tubes that conventionally the HSG did not pick up because it is mild, but it is mild enough to cause unexplained infertility. And lastly, is mild endometriosis. Okay, so some people they have the condition called endometriosis where there is it's like a chronic inflammatory condition where there is a presence of endometrial tissue in ectopic sites in places that it shouldn't be. Okay, for some people, this endometriosis might just be in its infancy, but it is significant. The effect is significant enough to cause unexplained infertility. So just to give a little bit of explanation to all these alterations that I've been saying. So the egg of a woman has chromosomes. Okay, so basically there are chromosomes which are the genetic the structures that carry the genetic information of every human being. There are chromosomes in a man and a woman. So in the egg themselves, so usually when there are alterations inside of the chromosomes of this egg of the woman, okay, it will make the egg to become very difficult to fertilize. Oh, yeah. So the sperm might even get to it, or will not be able to fertilize it because of that genetic alteration or the chromosomal anomaly that is present in the egg. So the body will judge the egg to be abnormal, and as a result, will not allow your sperm to fertilize it. That's number one. Number 2 is chromosomal anomaly in the sperm itself. So maybe the egg is okay, but the man's sperm has a problem, has genetic problem. When we say genetic problem, we're not talking about just having familial conditions. No, we're talking about the chromosomes, which is the genetic carrying structure, okay, in the
That's
egg, in
the
the sperm.
makeup of the egg or the makeup of
Yes, the genetic makeup of the sperm. Oh, yes. So basically, it has some anomalies. So some of these abnormalities that can be present could be maybe numerical or structural anomalies. So when we say numerical, meaning the number is not correct. You know, a man should have 46XY, a woman should have 46XX, something like that. So basically, when you're not seeing that the number is correct, that is now numerical anomalies. And all of these can make that sperm to be abnormal. And the body will not even allow such a sperm to fertilize the egg. The sperm would have lost its capacity to fertilize the egg. So that is the second problem. The third is that maybe due to one small alterations in the egg or alteration in the sperm, they resulted in the formation of an abnormal or a poor quality embryo. And for pregnancy to be established, that embryo must implant. Remember, for a woman to get pregnant, the woman must ovulate, the egg being in the tube. The sperm must be able to reach the egg inside of the tube of the woman, fertilize it to become an embryo. That embryo moves back over a couple of days into the endometrium, the inner portion of the womb where a baby stays and grows. And that embryo that is formed should be able to attach. So we call that implantation. So if the embryo is unable to implant, even though it has gotten fertilized, the embryo is unable to implant, pregnancy will not be established. There will be no pregnancy. Yeah, so there's a particular phase of the entire process of the reproductive cycle or so that is being fulfilled, but there's another phase of it that is failing, and as a result, pregnancy will not be established. So lastly is what we call, fourthly is implantation failure. Implantation failure is when the embryos fail to implant. So there are certain things that can cause implantation failure. It could be causes as a result of the embryo, maybe attributed to the embryo itself. there were causes attributed to the inside of the womb, or usually we call that endometrial causes. So there's something called endometrial receptivity, meaning the endometrium, which is the inside of the womb, is supposed to be able to accept, to be receptive, to receive, to accept an embryo. If the endometrium, the inside of the womb, is unable to accept an embryo, pregnancy will not happen. Okay, so this is now another cause. So usually we attribute that to, we say that's implantation cause or implantation failure. Okay, and the fifth cause, like I said, is mild tuber scarring, and lastly, endometriosis.
All right, thank you. I mean, that was very, very exhaustive, and at the same time, just like, oh God, okay. Um, Lifestyle factors like stress, diet, exercise, I believe that they are significant contributors to anything health wise, including unexplained fertility. But which lifestyle changes tend to make the most difference? Is it, oh, stop eating fatty food or exercise more? What would you say are the lifestyle changes that make the most difference?
Okay, so thank you for that question. Yes, I didn't mention the lifestyle earlier because it is not like a direct linkage, truthfully, to unexplained infertility. So that's the reason why I didn't mention it. But any which ways, the lifestyle of people have the capacity to impact on their fertility generally, like taking fatty food or eating very fast food. So this can increase the weight of both men and women, and in turn will result in hormone imbalance, cause chronic inflammation and the whatnots inside of the body, and of course would impact on the hormone balance of the body and ultimately affect fertility. So, secondly, smoking and alcohol intake, they have the capacity to cause deleterious effects on both the egg and the sperm health. So basically, these are really significant. Or even doing hard drugs and the rest can also impact. Stress even can impact on the hormone production of the body. It increases cortisol, and cortisol in itself would indeed certain the production of certain hormones in the body that will ultimately affect, the hormone balance of the body generally and fertility. So be that as it may, engaging in a healthy lifestyle, eating healthy, engaging in exercises can prove to be beneficial to the couple, to the woman, and to the man in improving both their egg quality and, of course, sperm quality. So basically, we usually advocate for eating a balanced diet rich in fruits and vegetables that are very rich also in antioxidants. Secondly, doing engaging in exercises at least 2.5 hours every week. Moderate intensity exercises, no serious matter there. Just like jogging, swimming, yoga, brisk walking, and the rest. And of course, avoid exposure to toxins generally. So toxins in this case, now we're talking about smoking,
Mhm. Alcohol.
now even alcohol and the rest, and even drugs and the rest things. So avoid all exposure to these toxins so as to be able to improve the egg health or the sperm health.
Okay. What are per the lifestyle conversation, what are the how do I want to explain this question? Is it a combination of lifestyle changes or lifestyle changes and medical intervention that can help? Or is it you start with lifestyle changes before you now go to medical intervention?
Clients when they come over to us, we usually would advocate for okay, engage lifestyle modifications for a while,
Okay.
usually 3 to 6 months. Yes. Now I will tell you 3 to 6 months. Some doctors to 1 year, but I think that's too much. I mean, these guys are already going through a lot, and we are not in the business of wasting the time of the client. 3 to 6 months is enough time for any reparative process in the body to have taken place. So we actually would advise for 3 to 6 months, engage lifestyle, take supplements, beautiful. In fact, speaking of, let me just use the opportunity to just do I say advise couples to get the fertility boost for him and for her. We currently have across all Sentai branches. It's not because I work in Sentai, but it's actually a beautiful medication. I was seeing a lot of results, a lot of testimonies. Let me use that word, in clients, and it's really doing wonders. A beautiful medication. It has all the supplements that every couple would require in order to improve their egg health and their sperm health. So take supplements, like I said, reduce your stress levels, eat healthy, go for exercises, sleep adequately, get well hydrated. Usually around this period, there should be marked improvements in their fertility. And so basically, we start off with the lifestyle and modifications, and before we graduate to medical interventions.
All right. So for the medical intervention, you've already mentioned the him and her fertility meant. What are other medical
Okay.
interventions that a couple can adopt to get better?
Treatment or
Um,
management of the unexplained infertility.
Even the is it not to get better? Everything is to get better as a form of
Okay,
treatment.
right?
Yes.
Right. Okay, so now talking about the medical interventions generally. First off, before we arrive at that, like I said, we should have actually diagnosed this condition, and there are
Yes.
ways to actually diagnose it.
Okay.
So again, we do all the tests, all the basic fertility tests. We now include specialized tests like what we call the karyotyping. I will still answer that question, but just taking it
Okay.
step by
Please go
we do
ahead.
what we
Yes.
call the karyotyping. So the karyotype we have to check the chromosomal structure, numbers, and size in both the man and the woman. It's actually a blood test that is done. So you do the karyotyping. After that, we can also do what we call the ERA. The ERA is what we call endometrial receptivity array or assay, as the case might be. These are specialized tests to check whether the embryos are moving into the endometrium at the right at the time where the endometrium is welcoming. Beautiful. Yes, when the endometrium is welcoming. Okay, so that's endometrial receptivity now. And then, of course, for some others, they will be required to do what we call the PGTA, what's called pre-implantation genetic testing for aneuploidy. So basically, this is a test that is only done during IVF. So you cannot just walk into any establishment and be like, I want to do PGTA. No, you only do PGTA when you have already undergone a phase of IVF. So basically, embryos should have been gotten. These embryos will be biopsied to check for any genetic anomalies inside of the embryos. Remember, we said pregnancy can only be achieved when an embryo implants inside of the endometrium.
Implanted. Yes.
So we want to check that that embryo now has the correct number of cells, the chromosomes are okay, there is no genetic condition that the embryo has that will prevent its implantation. We want to check all of this. As a matter of fact, PGT can also be used to screen for other medical conditions, Down syndrome and all the whatnots. Yes, so basically we want to check all of that. Okay, and for some other persons, they might need to do what we call the immunological testing, which is to check for antiphospholipid syndrome and the whatnot. There are still some other tests that we can also recommend to patients. These are also still, well, times slightly basic, like the
Okay.
thyroid function test, and like I just said now, antiphospholipid syndrome, antiphospholipid assay to check whether there's presence of these autoimmune antibodies that can attack an embryo or prevent implantation of an embryo generally. You want to do all of that. Okay, and basically that is that. So now to talk about the interview, once all of these has been done, of course we can now start to profile solutions when we've gotten our results. So if the problem is the embryo, we can now start to profile. Okay, these embryos that you guys have been forming in recent times most likely have a genetic problem inside of it. The chromosomes are not correct, the numbers are not correct, and all of that. And one of such solutions that will be preferred to them, okay, will be, of course, gamete donation. But any which way, that will be for people that have to do IVF. For some other persons, after all the lifestyle intervention and the rest, we start with baby steps. We start by doing ovulation induction for them. Ovulation induction is the kind of fertility procedure where we give medications like Clomid and Letrozole. These are common medications that are there to sponsor ovulation. So this can also be beneficial. But again, we don't really waste so much time on that. After like 3 cycles, you advance to the next phase. So, oh yes, after like 3 times of repeating, so just for people who do not know what cycle, so just 3 times of using the Clomid and the letrozole. If there is no result, of course, you graduate to doing procedures called like the IUI. IUI is intrauterine insemination. This is a procedure where the sperm of the man is injected into the womb, into the uterus of the woman, in a bid to give the sperm more like a head start to get them very close to
Yeah.
the tubes in order to fertilize the egg that is present in there. Yes. So basically, IUI again will be done for about 3 to 6 cycles. If it is not successful, the couple will need to do IVF. As a matter of fact, a lot of persons, yes, oh yes, it's not everybody that has that does IVF that has one problem that made them know. In this case now, having unexplained infertility can actually become the reason why a couple have to do IVF. And IVF in such couples would usually stand a very high chance of working because everything is okay with them. They don't have any so-called abnormality. Okay, they're just having some micro. I want to use the word microscopic conditions. They're just having some not physical, just something so micro, so minute,
Internal.
so tiny, yeah, so internal, and so and so basically they would require IVF.
Wow, wow, wow. I mean, that was because I mean, before you can know how to what treatment you did, you have to know what exactly it is that you have. Is the problem with me? Is the problem with the man? Is the problem with my egg? Is the problem with the sperm? Is it the embryo and all of that? It's just, I mean,
Exactly.
grateful for technology, medical technology.
Oh
Yes,
yes.
very,
Yeah.
very grateful for medical technology. Um, for IVF, yeah, I want you to explain that again because you said, oh, they'll have to go through IVF. Would they have to insert when they're taking the egg and sperm into the woman, or can you explain the IVF
Okay.
process again? Because you know
Okay.
the fertilization happens outside of the woman's body, then they
Oh
insert in
yes.
the woman's body, right? That's what it is. But
Yes.
and then you know that it's successful, but it's commonly said that the first time is unsuccessful, and then for a couple who's it seems like, oh, it's only for couples or for people that have money. If if I don't have money like that, I'm maybe not even middle class, I'm lower class, and there's this case of unexplained infertility. How do I then have my children, knowing fully well that if I'm able to just scrape maybe at the very most 5 million, I don't know how much IVFs cost, 5 million, and then you're not telling me that only she share it can work, it cannot work. How, like,
Yes,
what's the
cannot work then.
balance there? Yeah.
Okay, truthfully, like we said, sometimes we know the best treatment for a client, but maybe some when they come to you, even clients sometimes can be very open and they'll tell you, doctor, just forget about IVF. There's no money for that. What we
Mm-hmm.
are here, we're here for something that is lower, in the financial implication relative to the IVF. So we already know that, okay, IVF, even though it is the best for them, we would have to shove that particular discussion aside and then just focus on maybe the IUI or even the ovulation induction. And again, of course, we still have to institute, all the lifestyle modifications and the rest is, just take things stepwisely for them because of the financial implication involved for them doing a more specialized intervention. Okay, so basically, so now with that said, so like I said, let me just go over that again. So basically, when a couple comes in, there's no money. Oh yeah, start doing lifestyle modification, do ovulation induction. I mean, Clomid is not so expensive. Letrozole is not so expensive. You do that a couple of cycles, and by so doing, we're still buying them time in order to help them to maybe possibly. I mean, anything can happen in life. Possibly get money to do something better. That is if it's not like we'll do it with the mindset that okay, yes, we won't get any success from this. No, but we'll still give in and the woman will become pregnant. So basically, this is how IVF is done. So after embryos are transferred inside of the woman, usually medications are given to the woman to support the embryo development inside of her. And 2 weeks later, she has to do a pregnancy test. If the embryos are successfully implanted, of course, they would have started secreting the HCG and the rest, and of course, the pregnancy test will be positive. So, mind you, even though we are getting eggs out and then getting sperm and inseminating the egg and the sperm to form an embryo, okay, these are the phases, these are the things that happen inside of the womb. These are the phases of development that happen inside of the woman naturally. Okay, but we're doing it in the lab. So it doesn't really make the procedure so-called artificial. It's just like as if we're assisting a procedure. Okay, we're assisting, the same processes that should happen inside of the woman.
Yeah.
Okay, so when the embryos are injected in there, that is the same thing that has to happen. The embryo has to move from the tube into the endometrium. So in this case, now we're pushing the embryos into that same endometrium, which is the final point of movement before it implants and results in a pregnancy.
Woo! Just like wow. But I want to also speak to the emotional psyche of couples at this point in time, because I can only imagine the the weight of it on couples. So how can they support each other? How can partners support each other during this time? Because I can imagine that one person actually, because I've seen quite a few where they found out that, oh, maybe the issue was with the man, and then the woman is maybe more supportive, or maybe not even supportive. I don't want to do a gender thing right now, but we've seen, let's not lie, let's not steal that, when it comes to these things, there's more sympathy to the man when he's the one that has the issues from the woman. She wants to cover him and everything. But when it's the woman that maybe has an issue, or there's no implantation, there's less sympathy, from people, from family members. Oh, you are barren. You hear things like that. Oh, you are barren. Oh, you're this. Oh, you're that. How can partners support each other during this time? What are the things they can do to reduce tension? And what are the things they can do to avoid mistakes that they can make during this time?
All right. Thank you very much for that question. Honestly, the emotional side of every fertility journey is actually one side that even sometimes as doctors, we are usually blindsided to, because I mean, we're not the patient. We are just being very professional by telling them, we're just mostly sort of subtly disregarding the emotions of the client. And we're just being, okay, yes, this is what we have to do. This is what we have to do. We forget that people are humans and they have to go home to think about their lives. Okay, why is my own so different? I mean, there was this day, there was a client of mine who made that statement and was like, she doesn't know, out of her siblings, she's the only one that's experiencing this. Why is her life so different? Blah, 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 blah. I had to just shove all the fertility discussion first before and have to, just take sides with her and try to just alleviate her emotions and all of that. So basically, it is very important that during a phase like this, couples, they stick together, really. They stick together. And just like you rightfully said, it is easy to just cast aspersion or just point fingers at the woman, like, okay, yes, you are the cause. But on the side of the man, sometimes they do not get the same emotional what's the word? Do I say a backlash? Yeah, they don't
Yeah,
get the same backlash as the
yeah,
woman. But basically, I think I find that very unfair, because truthfully, the world cannot be populated without the presence of a woman. So women are actually doing a lot. In fact, there was this day I was now, just to digress a little bit before I go back to the question. I was having just a chat with my MD, okay, the group MD, and he made a statement. In fact, at that point, it even dawned on me truthfully that it was like, women are going through a lot. So, in fact, when he said that, it just, I don't know, there was this chill that just came, it like just ran down my spine. And I was like,
yeah. I remember
truthfully,
you
women are
mentioned
going
it.
through
Yeah,
a lot. I
yeah,
mean, we do a lot of procedures on women. And I mean, in fact, sometimes you need to tell anyone, don't worry, just breathe in, breathe out, breathe in, breathe out. It will be easy. We know it is painful, but we just have to do these things.
yeah,
And besides the physical pain, they're still going through the emotional pain. That woman has to go back home, maybe lie on her bed, weep a little bit, and now later pick herself back up and be like, okay, well, let me just still face it regardless. People have done it and they've gone through it. So it's a lot. So In all of this, we would advise that couples to stick together. It is not the time for one person to be talking back at the other
Yeah.
person. Be like, you are being the cause. So stick together. Seek counsel. It is very important. And besides seeking counsel, at some point, couples might need to take a break from even all of this because sometimes it takes a huge toll emotionally, especially for couples that have become so proactive in trying to conceive and they keep on getting a negative outcome. So for some cases, they might need, it's not for anything, it's not because they are giving up. No, it's for their emotional sanity, for their sanity, to be able to just pick themselves back up and refire. If you are exhausted in energy, you have to re-energize for you to be able to continue on a particular journey. It's just like a car, you're driving from here to Abuja, you get to a point you have to refuel. So that's how it is. So emotionally, you will need to refuel yourself. So sometimes it is important you just take a step back from all the okay, I want to get pregnant and I want to do all of that. You and your spouse take a step back and enjoy yourself as I mean, from the get go, I think at some point couples usually forget that okay, well, the idea to get married isn't just to just procreate. Sometimes you need that togetherness, build things together, enjoy life together, travel the world together, see places, and just do things together generally. So I think sometimes you just have to, when it is becoming overwhelming, you have to just shove it aside and then do the other things that you did even before you started trying to conceive. Just enjoy the world together. So, and lastly, of course, you can also seek counsel or seek help from, there are a lot of online communities these days, or even physical communities. Certain hospitals have them, certain churches have them for women that are trying. Seek that
Yeah.
emotional support
Oh
from
yeah, sure.
people having within the same having similar condition or similar problems. Sometimes you just try to gain support, emotional support in a group of like minds. Let's use it that, or like conditions. Okay, I hate to use that word, but let's just use it just from
Yeah.
those support groups generally. Yes, it's very important.
Okay. I mean, in the same vein, I would ask that, are there strategies that the couple can use to manage stress as well? In terms of, I know that, and I'm speaking as, I don't want to say ignorant, like as someone who's not medically inclined, we've seen videos of how, they have to inject the woman and all of that. How can the man that they have to be injected at home again, you'll be able to explain better, like how can the men help in the injection of things and not feel like, oh, you're stressing me, and not just leave it, because at the end of the day both of you are coming together to,
Yeah.
saying that you want to have a child, you've been on this journey for so long. How can the man even step up for those kinds of things?
Okay, all right. So, truthfully, we've seen it in the clinic a lot, where we explain that drugs should be, medication should be administered to the spouse. Usually, a lot of women are able to inject themselves. But for some men who are not so, I'm trying to refrain myself from using a word that is very, very, just out there. So, but for some men, they do not have the heart for it. So they'll tell you, no, I can't even do this. So what I can do, maybe I can help her by getting her a nurse to come to the house to just inject her every day. So that is some form of support, not allowing the woman to be like, okay. And for some people, the moment you're telling that the woman has to take injection, the woman herself will be like, oh yes, don't worry, I have a nurse that will give it to me. So sometimes silently we would expect that the man that would be like, okay,
Man,
yes,
that will
don't worry,
step
we'll
up.
get her.
Yeah.
Yeah, step up to be like, yeah, don't worry, we're going to get her a nurse. So that is showing support. So support cannot just be sometimes can just be even in your gestures, from your speech, just the way you understand certain things on behalf of your wife. So sorry.
Okay.
So yeah, basically, and that is that. So basically, I think that is me now trying to advocate that men should be able to step up for their wives when it
Yeah.
comes to injecting them, or maybe if you don't have the medical knowledge about it, or you are just too scared. I mean, some men are scared of of needles, giving to some, injecting somebody, or even injecting themselves. So basically, can advise that maybe they get someone to do it for their wives. Just give that emotional support. Okay, even while the wife is taking the injection, you can be there just telling her, "Pele." I'm just saying it just on a lighter note. You can be doing that. At least that still shows, that still helps. Yeah, it might not be so much, but then it gives us, okay, at least my husband is standing by me while doing this,
Yeah.
through the
Yeah.
entire process.
Okay, one final question I would want to ask is, what are the misconceptions? I think I have one, but I'll let you give the misconceptions about unexplained infertility, especially in this part of the world that we live in? And how do these misconceptions affect, the couple, either emotionally, socially, and otherwise?
Well, I think the commonest misconception out there, I will just say this one and I'll allow you to say the one that you is that some women, they just, some couples, they think that this is a normal thing. So they just feel like, okay, yes, it's not everybody that has to get pregnant 3 months after marriage or just 3 months after after the initial attempt of trying. For some people, it's like a standard. They'll be like, at least within 6 months. If we marry you into this family, you don't get pregnant, there will be issues. Something like that. No, so basically they have to know that yes, not truthfully, not everyone would go through that path. But for people who go through that path, it is not that they have a problem that is very, very obvious, like maybe tuber blockage or fibroids, or they might just be having a very subtle condition that is actually mitigating against their attempts or chance of getting pregnant. So basically, that is the commonest misconception out there, that most women go through this thing. So it is not anything. No, no. Really, it is not supposed to be so. But then, of course, we've seen that in recent times, couples are experiencing this, even up to 20% of the cases. But let me just hear yours, and
that the woman that's eating her babies. Or
okay,
that she's,
yes,
there's quite a few. Oh, she's eating her babies. Maybe she's an
yeah,
obanje, abiku. There's the one of, because she has maybe had abortions in the past. That one is
in
really
the
common
past,
in the past. So
yeah.
that's why her womb is destroyed. Yeah.
Well,
There's one for
truthfully,
village
yeah,
people. That is village people. So
people, yeah,
attack. And I'm not saying that these things that it cannot be spiritually inclined, but these are
yes.
many of them. Yeah.
Of the misconception. Yeah, well, truthfully, there's nothing like a woman is really eating her babies. But yeah, but yeah, with respect to the spiritual attacks, where we've seen that, I mean, we live in a very fantastic environment, especially in Africa. Now, I'm not just
Mhm.
saying Nigeria, in Africa. So we've seen a lot of things that I mean, when you want to judge it medically, you'd be like, oh no, there's medical explanation, but truthfully, it just has that base, but really it's being sponsored spiritually. But be that as it may, it is not all spiritual. Sometimes it's actually medical. Imagine a woman having like an autoimmune condition that would prevent our embryos from implanting. So that is like a medical way to say, okay, yes, truthfully, you're not allowing your embryos to implant. Or maybe having a woman that is having recurrent miscarriages. We usually have this same kind of misconception that your body, you're not allowing your body is not allowing the embryo, the babies to stay. They won't say that the woman is having miscarriage. They just say your body is not allowing. So that is quite antagonistic. And I think we should actually shun most of these our cultural biases and prejudices, because usually have these cultural, they are usually misconceptions any which ways of the age. And I think it's important that they are refined and actually abolished from the minds of people, because really in recent times, technology is doing a lot to us than we can really imagine. Oh, yes, while we're getting benefits, we're also getting detrimental effects. And so some of these things would have to be evaluated and actually brought to light for everyone to be aware of.
Absolutely. Thank you so much, Dr. Aboloje, for today's free consultation and advice on unexplained infertility. And me too, I learned, even though I'm done with my childbearing years, I'm so grateful. I've had, issues as well, but I mean, this was a great conversation. Dr. Collins is an assistant medical director and fertility physician at St. Ives Specialist Hospital. If you want to get in touch with him, you can download the Teledoc app on Play Store or the iOS App Store to have conversations with him. Thank you so much, Dr. Collins, for coming on the show today.
You're welcome. Thank you for having me. Always a pleasure.
Yes, and see you the next time on our next free consultation on Radio Doctor.
All right, I look forward to it.
All right,
Bye-bye.
enjoy the rest of your day. Bye. All right, many thanks to the producer Aisha Stani and Gloria and Benjamin producing me in the studio. Many thanks to the executive producer Tum Okewale Shonaya for today's edition of Radio Doctor. Find us tomorrow for another edition of Radio Doctor at 10 a.m. We also have even more amazing programs for you on Women Radio and great music to keep you company for today. At 12 o'clock is the news, and 12:05 is 16 days of activism on Women Radio. Do not go anywhere. My name is Fumi Bangala, and this is Women Radio. God bless.
to sponsor this program.